Around the Ozarks is now on your FM radio. Listen to Around the Ozarks mornings with Grace Gooley as I spotlight local people, stories, and podcasts, all while playing the country legends of the 90s and the hit makers of the 2000s. It's on the Ozarks' best country, 105.1 The Bull. It's time for Around the Ozarks Sports Scene, brought to you by Colton's Steakhouse, Thompson Sales, and Deadeye Gun and Pawn in Sparta. Here's your host, Scott Purrier.
Welcome into another edition of Around the Ozarks Sports Scene. I am Scott Purrier. As always, a big thank you to you for tuning in this week as we talk local, regional, national sports, whatever comes across people's minds in the Ozarks. We want to talk about it. Every now and then, about once or twice a year, we like to bring on our favorite sports doc, Dr. Heath Melugin with Cox Hospitals here in Springfield to talk about youth sports, injuries, prevention, you know, the latest pickleball craze of injuries, whatever we want to talk about injury-wise with sports, we turn to Heath Melugin. He's a former star soccer player at Kickapoo High School and Missouri State, went on to KU for his med school, had some time at the Mayo Clinic for residency, 5 years up there, U.S. Olympic Training Center in Colorado. He's been a little bit everywhere. And what are you now, 36? Well, I was trying to do the math. How old are you now?
That's pretty good, Scott. That's exactly right, 36.
36 years old. All this already. And you know, you don't think it's already because when you get into this line of work, it's a process, is it not?
It's a process. That's exactly right. There's a lot of hoops to jump through. And yeah, I can tell you, I feel old. I have a lot of patients that tell me I'm young, but I don't feel that way, Scott.
Yeah. And you know, what is it now? If somebody wants to do what you do, what is the minimum number of years of schooling they're going to have?
Yeah. So you have to do, of course, 4 years of undergrad, then 4 years of medical school. So that's 8 years. And then you do a 5-year residency in orthopedic surgery. And then for me, I further specialize in sports medicine. So that's a 6th year. And then you can get out and practice on your own. So that's 14 years after high school.
Wow. And there's a lot of athletes that, you know, that they say, I want to be a surgeon. They probably don't understand that part, do they? How long they're going to be in school to be able to prepare for the rest of their life.
It's a tough thing to fully understand. I mean, I think it's just like athletes, you know, that want to play a college sport. You know, we have a lot of very good athletes who go to college and play for a year or two, and it just ends up being more than they ever expected. And that's certainly how it is to get to practice medicine and be a surgeon. It's just it's a lot more than you could ever imagine, the process, but I think it's appropriate. It needs to be that way.
When did you decide again that this was what you wanted to do? Was it college, early part, or even at Kickapoo High School? When did you kind of think this is my niche?
Yeah, when I was in high school, I mean, I'll be honest with you, sports was kind of my whole world. I think I was a decent student, but it wasn't the focus of kind of everything that I wanted to do. When I got in college, though, when I started out, I set the goal of going to medical school. And as I got into studying anatomy and science and physiology, I really did enjoy it. And then I got the opportunity to shadow and be around specifically orthopedic surgeons. And I loved the aspect of the science part, which I loved, but also the ability to still be around athletics and be around that competitive mindset. And so that's really when I fell in love with it and solidified the goal of going on to do what I'm doing.
How hard is that? Because your major was what, molecular biology or cell biology, maybe a combination of the two. How hard is that to pull off in college while being a high level athlete like you were for Bear Soccer?
You know, it's very tough. You really have to just set goals. I would say that Coach Leamy and Coach Siebold at Missouri State were very supportive and understanding, as well as the professors at Missouri State. But I'd be lying if I didn't say it was difficult. In some ways, once I got to medical school, the fact that I wasn't juggling athletics and academics, it almost felt a little easier.
Yeah.
Because I think that was the toughest thing was in college. I had no idea how long practice was going to last, but I knew I had to study for this test the next day. And you just kind of had to take the time as it came, and traveling on the bus, in the Missouri Valley, it felt like it was 8 hours to get to any of our opponents. So we'd get home in the middle of the night, and you got to get up and you got to make it to class. So when I got to medical school, I was singularly focused on that. And in some ways for me, it was easier.
How big a help was Kelsey, your wife, but you guys have dated since high school and went to Missouri State together. Now you have 3 beautiful kids. Was she kind of that crutch when you didn't feel like doing it to maybe motivate you to, hey, get the books out?
Yeah, I would say, so she was in nursing school. And we dated all through college. And yeah, I mean, honestly, nursing school was very tough. So a lot of our dates were studying together, which made it easy. And then whenever I got in residency at Mayo Clinic, and we had 3 kids during that 5 years, she held up the home front, and I worked, and I really don't think I could have done it without her, without a doubt. And now, she gets to play pickleball, and I go to work, so it works out good.
Is she good?
She's actually good. She told me she played for 4 hours today.
Wow.
So I'm a little worried she's going to come up with an injury, Scott. But
well, that's what I wondered. Has she been in to see Dr. Melugin yet?
Well, she's been in, but nothing serious so far.
That's good. Well, and we might as well start off with pickleball, because the serious stuff are the people of my age, early 60s, that still think they're 30 and play, right? I mean, they keep your office pretty busy, I would imagine.
Oh, yes. We have a lot of pickleball injuries. And, I've taken care of, I would say, a good number of people where they got injured going out, and they just decided to pick up pickleball for the first time and got injured. So a lot of times, it's people that haven't been active for a while, and then they say, you know what, I want to pick up this new activity, and it certainly keeps us busy.
Well, you are one of the top orthopedic surgeons in the region, and if not nationally, on that path. What parts of the body do you work on? What parts do you not work on?
Well, so I would say the main areas are hip, knee, shoulder, a little bit of elbow. There's not as much elbow pathology as there are hip, knee, and shoulder. And then for pickleball, for example, I also do Achilles repairs. So we see a lot of those, but my main focus would be hip, knee, and shoulder. And then for sports medicine, I certainly do joint replacements in the knee and shoulder, but sports medicine tends to be more trying to repair our native anatomy rather than replace it with metal and plastic. So ACL tears or rotator cuff tears, or in the elbow, a UCL or Tommy John injury, or in the hip, a labrum. So that's a lot of what we do.
We've got to find something that's your deal. I mean, when, Tommy John surgery, he got it named after his elbow, and everybody went to see Dr. James Andrews. They knew that we got to figure out if you're the hip guy or the shoulder guy or the knee guy. So pick one and let's run with it, Heath.
Yeah,
okay.
I'll work on it.
Yeah. Well, and I was thinking about this. You played soccer at Kickapoo in the early 2000s, graduated, I think, 2012 from Missouri State, your time there. How much has technology and advances in medicine changed the recovery time from the time you were an athlete to how quickly you can get somebody back up and out on a field now?
It's changed a lot. We've had some really good advancements in our field. So specifically Tommy John, I would say, since 2012, whenever I graduated college, that certainly changed a lot. You look at Bryce Harper, how quickly he was able to get back after his Tommy John surgery. And the difference is what's evolved within elbow and baseball is that we can do what's called a repair of the UCL with what's called an internal brace.
Yeah.
So Arthrex is a company that's very innovative, and I work with on a daily basis, and they developed this, what's called an internal brace. So it's a really strong suture that's collagen coated and has really provided some advancements. And now we use that same internal brace in our ACL reconstructions. So for the knee, which we think protects it for a certain amount of time post-operatively.
So when a guy has that internal brace, and that's elbow, correct?
Elbow.
Is that like does it ward off any more surgery, or is it temporary for those guys, or is it just a shortcut basically to get back on the field?
I would say that it really protects what we repair in the times whenever they're most at risk of re-injury. So we can really advance their rehab protocol much quicker. So for example, Aaron Rodgers, when he had his Achilles repair, what allowed him to even consider getting back that first season, although he didn't, but they were hopeful, was the fact that an internal brace was used in that scenario. So that does allow us to really speed up the early recovery period. But, with all of these advancements, we still have to wait on the human body, and we can't change too much of that. We're looking into different things such as platelet-rich plasma, PRP, which some people think of as stem cells. It's technically not, but that maybe can increase some healing rates. I have patients all the time using certain type of peptides and different things. So we're always looking for ways to move that meter just a little bit, especially when we're talking about athletics.
Did they use internal bracing on Mahomes on that knee? Do you know, or have you heard?
Yeah, I don't think they did, but he got what's called, they used patella tendon, BTB, or bone tendon bone. And with that graft, it's still the gold standard graft. Whenever people get an ACL reconstruction with a quadriceps autograft, we tend to use internal brace more. But just because of some of the nuances with the technique, patellar tendon isn't used with an internal brace as much.
He got hurt, what, week 15, maybe? It seems like he missed
about
right.
I feel like
3.
Yeah.
Is it reasonable to expect him back training camp or game one? I mean,
Yeah, I think that would be, if anybody can do it, certainly Patrick Mahomes. I always think of when Adrian Peterson got back so quick after his ACL. I think he came back and was rushing like crazy, 8 months later. I would say it would be very hopeful to think he'd be back by game one. And I think they're probably not going to push it, would be my guess. But I bet you he's back by week 3 or 4, somewhere around in there.
Which is why they went and got Justin Fields to
right.
at least have somebody with starting experience that could step in.
No, that's exactly right. Generally speaking, after an ACL, that's actually shifted a little later, to be honest. So in the past, athletes were getting cleared at 6 months. But what we saw was the re-tear rates were significantly high in some of our high-risk athletes. So it's really shifted more towards 9 months, which is tough to tell these athletes that, hey, it's in your best interest to wait 9 months, because a lot of times they feel pretty good around 7 months. Yeah. But we know if we can just give the graft a little more time to mature, that their risk of re-injury lowers.
Yeah, I remember watching Trevin Brazil in particular, the Arkansas kid from Kickapoo, and went to Parkview earlier than that. And unfortunately, my son and I were at the game where he tore his ACL, I think his sophomore year, and just the tentativeness, that next year, there wasn't that desire to jump in there in a loose ball situation or things like that. How does that, you think, affect Patrick Mahomes? Because the Mahomes we've watched the last 2 years has been so effective on the ground, and he's been their leading rusher in a lot of games. Is it hesitancy mentally in somebody like that, or will he physically be able to do the things technically that he always did from the time he comes back?
I think he'll get there. There's always a psychological component. Now I would say one of the things that makes Patrick Mahomes so good is because psychologically he's incredible. He has the ability to forget mistakes and move on, which makes him, unbelievable. I will say, though, I think it would have been easier for Tom Brady to come back after an ACL reconstruction than Patrick Mahomes, right? Somebody who stands in the pocket and is a pocket passer probably is going to be able to get back pretty easily. Somebody like Patrick Mahomes, when he makes the magic happen is when he's scrambling out of the pocket. So I think it'll impact him the first season, but as long as he stays healthy and doesn't have another injury, I think by the end of season, I bet you he's back in it.
Back to being Patrick Mahomes, right?
Yeah.
Well, let's get to some of the questions that we talk about occasionally when we do this, and maybe some people that are tuning in for the first time and just kind of from sport to sport. But you have a son, you have 2 daughters and a son. If your son wanted to play youth football right now, what would you tell him? What is your level of confidence in that sport that things are moving in the right direction in terms of safety?
I think football is a great sport. I mean, I don't think there's much of a need to get into tackle football too soon. So he's 7. I mean, I'm not sure how early they are starting tackle football now, but I certainly wouldn't let him at 7. And from my standpoint, certainly not until middle school is there a need. And I think the biggest reason for that is just a risk of brain or neurologic injury, or that kind of repetitive micro injuries over time. And I think when you look at football, I think a lot can be learned without hitting that early. But I think it's a great sport. I think they're taking a lot of precautions to make it safer. So I wouldn't have a problem with my son playing football at all, honestly, but I would protect how early he's hitting.
Sure. And do you think the new helmets, the kind of the oversized cushion on the outside, is that helping the situation in terms of a brain injury?
Yeah, it sure seems like it is. So in some of the data I've seen on it, it can certainly be helpful.
And I think we're seeing more and more teams, from the pros down to the college to high school and maybe even youth that are hitting less in practice. They're curving, and that's always going to be something that helps as well too, I would think.
Yeah, absolutely. I agree.
Yeah. Baseball wise, where are we on now? Pitch counts, and what age should we have pitch counts? Are curveballs still a bad thing at a certain age? Kind of give us the baseball rundown, what you see coming into your offices now, and at what age it starts and why.
Yeah. Well, I would say parents that I talk to are certainly becoming more knowledgeable on kind of being hyper vigilant and watching the pitch counts for their sons who are throwing. Inevitably, the bigger, more athletic and precocious kids tend to get put on the mound, and they're throwing. Historically, when we first started to learn about pitch counts and watching that, those players, whenever they were taken off the mound, would go straight to catcher. The problem is they're throwing the ball right back to the pitcher every time. So that's another thing that I know the coaches I've talked to and parents that I talk to when they come into clinic, everyone's kind of watching that a lot closer. And so I would say that's getting much better, but we still see a lot of Tommy John injuries, shoulder injuries. And I think that's just inevitable as people try to throw hard and kids, feel a little bit of discomfort, and the tough ones don't say anything about it. And then we have an injury. But, all we can do is educate about it and make sure. I think the biggest thing is that coaches aren't forcing kids to keep throwing. And I feel like that culture has really, really changed, and parents are being smart about it.
Is it worse to throw hard and throw too much than it is to try to throw a curveball these days? How does that break down?
Yeah, I think that's the general thought, is that it really has more to do with how many hard throws you have. Historically, there was certainly concern about throwing curveballs and moving the ball. I would say the data is a little unclear on that, whether that actually increases risk. But I think what we know for sure is that pitch count matters. And the MLB on their website has the recommended pitch count for different ages. And I know that's looked at often.
And, that starts at what age? Probably start kind of watching that at 10, 11, maybe?
Yeah, I think so. I think as you shift out of coach pitch, probably it isn't as big of a deal right away. They're just trying to be accurate with their throws. But probably once they get into that 4th, 5th grade range and people are traveling, each weekend with their teams, that they really need to be looking at it.
I follow a lot of Major League Baseball, and there's writers in every market that are saying those guys that are throwing 101, 102, they're just an arm injury or a shoulder blowout waiting to happen. In your mind, is that true? Is that accurate?
Well, it sure seems like that's kind of the case. I mean, I feel like those guys don't last super long. When I just look at how many guys threw over 100 and how long they lasted, in the league. I mean, I feel like they've got a short lifespan. It's just one of those things where when they're a freak athlete like that, is the body really supposed to be able to withstand that kind of torque and velocity? Probably not. I think it's the same thing we see in like the NBA, some of those guys who are 7'6" and uber athletic, but they are like a Zion in the NBA, just these freak athletes. I just don't know how long a lot of them, their bodies can last. That's why it's amazing if you look at like a LeBron James, who is just a freak of nature, how healthy really he's been throughout his career.
You hear some dads say that, when a 14, 15, 16-year-old kid needs Tommy John, well, he'll come back stronger than ever afterward. Almost like it's we're getting that out of the way, we're good to go. Mm-hmm. Is there anything to that, or is that just kind of a wives' tale, so to speak? Or do most guys come back stronger than they were after the surgery?
I would say it's not always the case. I've definitely encountered that in a lot of scenarios where I believe that some parents and athletes who are pitchers kind of think that injury is almost inevitable. And when it happens, if it's a scenario where sometimes, they can rehab and avoid surgery and get better, they don't really want to waste any time with that. They just want to get the surgery. And in their mind, they're going to come back stronger and throwing harder. But I would say it is a successful surgery, but there's risks with any procedure. And, as surgeons and doctors, we tend to always think about and remember those athletes who maybe didn't get back to the form that they hoped to. So I would say it's not worth just having the surgery if you don't need it. So there's just major risk to those procedures, and we certainly like to avoid it if we can. But at the same time, it's an incredible surgery if somebody needs it.
Will we ever conquer ACLs in basketball? I mean, will there be medical technology that'll make it less likely for somebody to tear an ACL, especially on the women's side? Or is that just inevitable because of the nature of the movement on a basketball court and coming down wrong and things of that nature? Kind of your thoughts on the ACL on the men's and women's game.
Yeah, that's a tough one, because soccer's a huge one, and females are certainly at more risk of it. At Mayo Clinic, whenever I trained there, a study was done looking at female soccer players who came back after an ACL reconstruction, and their risk of re-injury to that knee or an ACL tear on the other knee was 34%. Wow. So those are huge numbers. What we don't have, and what we know, is that the braces that sometimes athletes wear, those do not prevent an ACL tear. So we don't have anything that you can wear that helps prevent that. There is some good data that preventive exercises, especially for females, kind of teaching them how to land so they don't land in a knock-knee position or what we call valgus. And that having female athletes start this at a fairly young age, maybe even 8, 9, 10, 11 years old, there's been good data to suggest that can lower the risk of ACL tear. So I think that's really where hopefully we're learning, and maybe we can incorporate that into some of our public schools and to PE and that sort of thing.
So when we see, we watched Jackson Cantwell play at Nixa for 4 years and obviously played very well, and he's doing it now at the University of Miami. He had on knee braces when he played. What is the purpose for a lineman in that situation that has not been injured? Does it stabilize to where it's less likely to suffer an injury if somebody dove into it, or is it a confidence thing?
That's a great question. So those are functional ACL braces that, for example, Jackson was wearing and all the linemen wear. And what that has been shown to prevent is MCL injuries.
Okay.
So whenever the linemen are blocking and, the opponent or one of their own teammates falls over and kind of rolls over onto their leg, that kind of pushes the knee into that knock knee type position. And what can happen is that you can sprain or tear your MCL. And those braces have been shown to prevent that. So that's really what they were wearing them for.
Okay. We've talked about it in the past, but it bears repeating. Weightlifting for young athletes. In your mind, what is a reasonable age to start doing it on a light basis and then really get into it at a later age?
Yeah, I don't know if there's an exact age, only because kids develop differently. I would say that I think the key is to start with lower weights. I think functional movement, even as early as 7, 8, 9 years old, it's just fine. I think it's great to build strength, but what you don't want is to be throwing around too much weight. I encourage my kids and some of the patients that I take care of that are looking for ways to get stronger is body weight type stuff, push-ups, sit-ups, wall squats, that sort of thing. Get out and run. I think the biggest thing, Scott, when I was growing up, I grew up with your kids. I mean, we were outside climbing trees, running around the neighborhood. And to be honest with you, I think that those are some of the best things that kids can do. But I also think in Springfield, for example, at Red Line and different places, there's some really good programs for kids to start to learn how to lift properly with good form and not push too heavy a weight around too early.
What do they risk if they do try to do too much too soon at an early age?
Yeah, so I would say the biggest risk would be injury to, for example, certain growth plates. So as kids develop, and of course, as everyone knows, they grow through the growth plates in the bone, and those growth plates are made of cartilage. So it's much easier to injure those when it's soft cartilage, whereas in adults, it's completely fused and it's all bone. So we'd have to break a bone to injure something. But in young kids, you can have a stress type injury to those growth plates. That's what we see sometimes in young baseball players, where maybe they don't injure their UCL, but they injure the growth plate right where the UCL attaches. Or there's something called little league shoulder in young athletes, where there's a stress type injury in the growth plate in the upper arm. And so those are the biggest things.
If you injure a growth plate, does it literally stunt your ability to grow, or what does it do?
It certainly can, but I would say the biggest thing is it causes pain, and then it's tough and takes a long time for that pain to go away. And sometimes, for example, in the little league shoulder I talked about, in these throwers, we actually have to kind of really shut them down almost until they stop growing and that growth plate fuses, because they just repeatedly and repetitively injure that and cause pain.
Last question, and these are always fascinating to me to actually, talk to somebody who this is their world. But you played soccer, you obviously very good at it. Your wife played soccer. Then you guys have 3 children. Where I'm going with this is, what are the best sports for new parents when those kids get to be 3, 4, 5 years old in terms of developing balance and hand-eye and all the things that you want them to develop? What are some of your favorite sports in that regard? I know you're going to be biased. I know it's coming. Go ahead and get soccer out there first and foremost.
Yeah. Well, I think soccer's an easy one. Parents do have a lot of opportunity to get their child out there playing soccer. The good thing about that is they're running. It's a team sport. Certainly initially there's not a heck of a lot of organization to it. So they can run around and kick a ball. I think that's important. I think some of the just sports that aren't organized, as far as just making sure your kid gets out and rides a bike and runs around, I think that stuff's important. As far as my kids go, one of my daughters got into gymnastics very early, and I think it's a great sport initially to learn balance and coordination with your body. It also kind of teaches you to have a strong core and certain things like that. So I think even for boys or girls, that's a good one. Other sports I love, basketball. I think it's an incredible sport. It teaches you eye-hand coordination. And, that's a little bit tougher because initially you got to be strong enough to get the ball up into the hoop and that sort of thing. T-ball's another one. America's pastime. I think every kid needs to get out there and have a little bit of experience with that.
So it sounds like any and all of the above. Just get them outside, get them off the phone, get them off the tablet, get them outside.
I think just get them outside, make sure they're running around and having fun. And I think that's the key without a doubt. I do think a lot more kids are getting into golf these days, it seems like, which I think golf's a great sport as well. A lot of things to learn from that.
Do you play?
I do. And two of my kids are starting to get into it as well. So.
Awesome. And please tell me you could beat Alex Hall in golf.
He's actually pretty good at golf. So he gets to do it more than me. Whenever I'm working and doing surgery, I think he's on the golf course a lot.
That's probably, I would rather have you doing the surgery than him, though, to be honest. That's probably a good trade. But Heath, as always, enjoy our talks and let's do it again soon. Okay.
All right, Scott. Thank you, buddy.
Yeah. Appreciate it. Dr. Heath Melugin, one of our favorites, again, just a phenomenal soccer player in his time at Kickapoo and Missouri State, and just as good at what he does now as he was back then playing soccer. He's one of the most noted and rising orthopedic surgeons in the Midwest, if not the nation. You're going to hear a lot of stuff about Dr. Heath Melugin as we go forward there. Podcast wouldn't be possible without our great sponsors. We want to thank Thompson Sales. Of course, they are over off East Independence there. They've been in business since 1919. The Thompson boys have been dealing, and their dealership is the home for the largest selection of Cadillac, Buick, and GMC cars and trucks, new and used. They've got a great service department over there. They're redoing their oil change facility there off to the, I guess that'd be the west of the dealership. And I went in there last week, in and out pretty quick, and on my way. But that's what they do at Thompson's. They treat you like family, and you're going to get a great deal on your vehicle and your service. Go see the Thompson boys. Again, the Thompson boys have been dealing since 1919. Big thanks to Colton Steakhouse of Springfield, just down the street from Thompson's. They're at 2020 East Independence. And of course, it's a great place for steaks, barbecue. They got salads that are awesome. Their burgers, those fresh peanuts, and then the homemade rolls and the whipped butter and honey. All of it's good stuff there at Colton Steakhouse, 2020 East Independence. Stop in for lunch or dinner and go tell Thomas Orr and his team we said hello. And then finally, Deadeye Gun in Sparta. Happy birthday to Jonathan Lawrence this week. He's one of our great sponsors. They are at 7483 Main Street in Sparta. You can visit deadeyegunsupply.com to check out their great selection of whether it's rifles, pistols, ammunition, the latest in hunting technology. Jonathan's got it there at Deadeye Gun in Sparta. Big thanks to all three of our sponsors. We're going to do this again next week. We will see you then on Around the Ozarks Sports Scene.